So my name is Sarai Ramos. I am the Director of Policy and Advocacy for the Latino Action Network Foundation. I want to thank you all first for joining us today for this very important conversation during Minority Mental Health Month. We did want to have a webinar that talked about the intersections of mental health and sexual assault and sexual violence in the Black and Brown communities. So currently, it doesn't look like our interpretation is working at the moment, but we will be working on that and getting that fixed. But just for those who will need it in the future, these are the instructions, and I will make an announcement once we have that up and running. Oh, hold on. It looks like we have it now. Okay, yes, it looks like our interpreters are here. So Spanish interpretation is up and running. So please, if you need interpretation in Spanish and you want to listen to this conversation in Spanish, please click on the little globe icon on Zoom and you can select Spanish as language and then mute the original audio. And then I'm just going to take a second to say that in Spanish as well. Entonces, nosotros sí tenemos disponible interpretación en español. Si quieren escuchar a esta conversación, pueden buscar el globito, hacer clic para español y poner en mute el audio original.
1 hour.
Okay. I'm just going to leave this up for another second or two so people can read it and set interpretation up. Okay. And so I do want to provide also a little content disclaimer since we will be talking about some sensitive topics today around sexual violence, sexual assault, and mental health. So if you find any of these topics triggering or if you find that you need a break at any point throughout this conversation and this webinar, please feel free to take a break and step away from your computer because we do want to prioritize your mental health and your well-being during this conversation. Okay, and then I'm gonna jump into introducing our two lovely speakers for today. We have a presentation which will be given by Kelly Klinger from NJ CASA or the NJ Coalition Against Sexual Assault. And then we will hear from Don Jackson on their lived experiences as well. So Kelly Klinger. Okay, give me 1 second. Sorry again, we're having issues with our interpretation. Kelly, would you mind actually introducing yourself while I get this situated? I'm really sorry for this.
No worries at all. Hi everyone. So I already say my name is Kelly. I use she, her pronouns. I am with the New Jersey Coalition Against Sexual Assault. We're usually referred as NJ CASA, but that's not to get us confused with CASA, which is Court Appointed Special Advocates. So we get that a lot too. But I have been with with NJ CASA for a little over 2 years now, and I provide support for our 30 member programs. And our member programs are all throughout the state of New Jersey that provide holistic services for survivors of sexual assault. And before I joined the coalition, I did direct service work at nonprofits and just supporting survivors of domestic and sexual assault.
Awesome. Thank you, Kelly. We do have interpretation up and running. Again, I'm so sorry for that. Thank you, everybody, for your patience. And thank you, Kelly, for your introduction. Um, Don, would you like to go ahead and introduce yourself as well, just really quickly? I believe you're muted.
Yes, I would. Yes, I would love it. Good afternoon, everyone. My name is Dawn Jackson. Excuse me, getting over being sick. But anyway, I'm a mother, grandmother, I'm a wife, but I'm also a survivor and thriver of sexual abuse, assault, domestic violence. I served 25 years, 9 months in prison for the unintentional demise of one of my abusers. And on the inside, I took a lot of courses, classes, college education. I educated myself on the things I was running from for a very, very long time. So here I am today, gracefully, and I'm just glad to be here to support everyone who relates to stories like mine. Thank you.
Thank you, Don, for joining
You're
us.
so welcome. Yes.
And so we're gonna get started today actually with Kelly and a presentation that she put together to talk about the work that she's been doing with NJ Casa and the work that NJ Casa does in general. So Kelly, you have the floor.
Thank you. I'm gonna share my screen. Okay. Oh, did it switch again?
Yeah, it's in the
Okay. I
speaker view.
don't even need that. Hold on. Okay, is that better?
Yep, that's good.
Okay, great. So hello again. Thank you for having me and NJ Casa here to speak with you all in this really important conversation. So I'm just going to give like an overview of sexual violence and just a little bit of our work. So again, my name is Kelly, she, her pronouns, the membership engagement specialist with NJ Casa. And so who we are, I kind of gave that a little bit in the introductions, but we are the New Jersey Coalition Against Sexual Assault. We are a statewide organization that primarily focuses on sexual violence. We do not provide direct services for survivors. Rather, we provide advocacy, training, and technical assistance, and support and collaboration for our 30 member programs, who then provide the direct service for survivors. If survivors do reach out to us, we do connect them to support in their local counties that they're from, or maybe other support that they would need. So we wouldn't turn anyone, any survivor or any community member away. We just would try to help get them connected with the resources that could best provide the services to them. So I mentioned we have 30 member programs, and our member programs consist of the 21 county-based sexual violence programs. So in every county, there is at least one sexual violence program, and they provide counseling, crisis intervention, prevention, education. They can provide court or police accompaniment, hospital response. And all of that is free and confidential services. We also have 8 culturally specific organizations that provide sexual violence support services through the culturally specific lens. Excuse me, and they're all throughout New Jersey too. And then Rutgers University Office of Violence Prevention and Victim Assistance in New Brunswick location, their office location also provides services for students at Rutgers University. So I know it was given earlier, but we also in our content give a content warning just because it is really sensitive topic. And so we always want to be mindful for our audiences. And so just take care of yourselves however you need. I always say in person, like if you need to step out of the room, I'm not offended. So if you need to step away from the computer, we wouldn't know, but we would not be offended as well. So what is sexual violence? Sexual violence is any type of unwanted sexual interaction, ranging from unwanted sexual assault comments or sexual comments to sexual assault. And some examples. So it can encompass a range of examples, right? So we talk about non-contact, right? So that can be harassment, the unwanted comments, threats, lewdness. That's when you're showing off your parts to someone else without their consent. Digital-based forms of violence, right? We see a rise in AI or technology and just how information, pictures, and unwanted contact is being disseminated across. So those non-contact, more verbal is still considered sexual harassment and sexual violence. Contact, we talk about, we mentioned is groping, forced or coerced penetration. This is very important to just kind of note that males can experience, unfortunately, violence of sexual assault and are survivors. So when we say forced or coerced penetration, we say like forced, right, making someone penetrate someone else's body without the consent of wanting to do that. Coerced penetration, again, is just when it's happening to you. So either or, if someone is making someone penetrate someone else, whether the receiver, the perpetrator, anyone it's unwanted in any way for both parties, it is sexual assault. Being forced or coerced to penetrate, again, that's making someone forced to penetrate someone else. That is also a form of a bodily autonomy violation. And so we see that sexual assault can typically create or exploit an existing imbalance of power. We're going to talk about that a lot, especially in our discussions. But it is when someone demonstrates a level of power, authority over someone else to do these egregious acts or just make someone else feel unsafe or uncomfortable. And so sexual violence can happen to anyone, regardless of age, identity, background, socioeconomic status, and education. And it can be caused by anyone, regardless of the same identity, age, background, everything I mentioned. And it can occur anywhere at any time. So these are some myths or facts that you may or may not have heard, but it can happen to everyone and anyone, unfortunately. And those who are causing harm are typically known to the survivor. So it could be like a partner, a friend, a family, coworker, classmate, right? So it's not, while it can be that stranger you hear in the narratives, they say it's like the stranger off the streets. That can happen, but more likely than not, the perpetrator is someone that the survivor knew because they had their trust. It was someone they trusted, and that trust was violated. And so again, back to exploiting the power imbalance. If it's someone you trusted and knew, and then they take advantage of that. Okay. And so when we talk about sexual violence, it's also very important to talk about consent, right? And what do we mean by consent? And consent is affirmatively given. So there is a firm yes or no, right? It can be withdrawn at any time. So if I said yes 5 minutes ago and now I say no, still valid. You can stop. If and consent cannot be given if the person is impaired or intoxicated under the legal consenting age. And so because of those factors, then consent is not present and the person is unable to give consent. If compliance is obtained through threats, coercion, that is not consent, right? So an example, if someone is asking you to do something and you say no, and then they keep asking you and you're just kind of tired after the fifth time, so you just say yes, okay, all right, that is not consent, right? Because it is through coercion or you're just tired. It has to be an affirmative yes or no, affirmative like your first time response. So if again you're just kind of saying it or you're saying it because um, you don't want to face any threats or repercussions or any harm to you if you say no, those if you feel danger in any way and you're saying yes to avoid those are not consent. And so it's just important to understand and know your rights of like consent and what it means to say yes or no, or to give a firm decision, and also to know it's okay to change your mind, right? Just saying consent once does not give you consent throughout all the duration. And then getting into some statistics, the prevalence of sexual violence. In our home state here in New Jersey, there are approximately 2.7 million survivors of contact sexual violence. So that's 1 out of every 3 people in the state. Over 37% of women have experienced contact sexual violence, and approximately 15% of men have experienced contact sexual violence. And we know that prevalence rates have been shown to be higher for those with marginalized and minoritized identities. And diving into those, we see in some other statistics that 32% of multiracial women, 27% of American Indian, Alaska Native women, and 20% of non-Hispanic white women have experienced rape at some point in their lifetime. We see that 47% of transgender were sexually assaulted at some point in their lifetime. And those who have experienced sexual assault at some point in their lifetime, we see here that 65% of American Indian, 59% multiracial, and 53% of Black. So we see here of like just jarring statistics and how prevalent this is in our society, unfortunately. Um, and so it just shows that a lot of these statistics, while it shows the numbers, some of it is still probably underreported. And so we see that reasons for that could be just barriers to reporting and accessing help. And we'll get more into that in our discussions. So just some more rates here. You see here among women with intellectual disabilities, about 12 times the rate. Okay, and I wanted to briefly touch upon the Victim Assistance and Survivor Protection Act. It's also known as FASPA, and whether you need it or you might know someone who might need it, this is very important information to know, and it is widely on the internet. On our website, you can find more information about it. So FASPA is an act that expands the opportunity for survivors of sexual assault and victims of stalking and cyber harassment to apply for a protective order against the person who caused harm without having to report to law enforcement or filing criminal charges. And that includes sexual contact, lewdness, stalking, and cyber harassment. So this is an avenue someone can explore if they want to get a protection order. And it is a civil order. So under that, you can go apply for it at civil family court, and it just prohibits the person who caused the harm to have any further contact with the survivor. And again, it's just very important to emphasize that you do not need to file a criminal charge to seek a SASPA order of protection. And so when you're filing a SASPA, you can have the right to speak to an advocate, who then can provide assistance to you in safety planning, go over what it means to seek a protective order and kind of break down the legalese, because we know those jargons can be overwhelming, and also just understanding the court process. And the advocate can be there to just provide accompaniment at every step of the way, because no survivor should have to experience this on their own. And some other resources for survivors. So like I mentioned, there are local sexual violence services in each county, and including 8 culturally specific organizations across the state. You see here we have our state hotline number. So each county also has a hotline number that can connect you directly to the county that you reside in or where the incident occurred. But you can also call the state hotline and they can connect you further to other states or other resources. And then this is our website. It's our resource page where you can find your local sexual violence program and click, and it'll direct you to their website with their information. And like I mentioned, they can provide these local programs or trained advocates, counselors, just anyone who can provide crisis response, accompaniment for survivors at hospitals, courts, police stations. They also can provide support groups and counseling, case management, so much more. These our programs are really incredible, and they're well trained in domestic and sexual violence, and they are here to support survivors, all free and confidential. Um, and forensic examination, I've mentioned that a couple times. I just want to quickly go over what that means. So someone who have experienced sexual assault can have the option to go for a forensic examination at a hospital within the first 7 days from the assault. In some cases, it can be up to 9 days following the assault, but that is really is case by case. And I do want to just say that this is a very deeply personal option for a survivor. It should never be pushed upon someone to make this decision, but just to let them know that they have the decision to get they have the option to get a forensic examination if they would like. There will be a trained nurse. They could also have law enforcement part of the process, but do not need to. It's not required. And they can also have an advocate in the room, likely from one of the local sexual violence programs, to provide support. And they can also, and then survivors can also choose to go through the criminal legal system. Again, deeply personal decision. These are just options that we like to share with everyone, but they do not have to pursue criminal charges. And if they do not pursue criminal charges, they can still get a protection order if they are feeling unsafe from the perpetrator through the civil relief, the FASPA order that I had talked about earlier. So there are some ways, avenues that survivors can explore. Not all of them will be for them, or maybe they will be, but these are just options that we make sure survivors are made aware of. And then that's my information. Can also drop in the chat for anyone who have questions for us, and I can drop the website that had our resources as well. Thank you.
Awesome. Thank you so much, Kelly. And hopefully we are able to send that PowerPoint presentation out afterwards, or if not, send out the resources that you mentioned for sure after this conversation, as well as the recorded video of this webinar and everything else. So again, for people in the audience who have questions, please feel free to drop them in the chat. We will get to them after or towards the end of our conversation. But right now I'd like to pass the floor off to Dawn and hear a little bit about her and what she has to share with us today.
I'm back. Yeah. Can you hear me?
Yes.
Oh, geez, I can't find the screen. So sorry. There we are. Okay, so what I would like to share with everyone is life for me started out at 5 in a very, very difficult way. And that's where I remember a lot of things. Um, the sexual abuse, the violence, the domestic violence, and I had no idea that this is what was going on. In the home that I was living with my mother and her first husband. So at age 5, that's like I said, that's where my story begins. And that's also where my childhood, I felt, stopped. I became a woman long before my time. Um, there were 5 male family members, and there was one family friend who had a hand in violating me when I was just a child. You know, for a long time, I would say what they were doing, the men in my family were doing to me, not all of them, but what I was talking about was all the sexual abuse, the assault, and everything that they were doing, to me. But I had a mother who was right there. My mother had an addiction, and because of that addiction, and I'm not using it an excuse or anything, but I'm saying when you have a dynamic like that in a home and you know what's going on, you see what's going on, but you avoid it and you refuse to discuss it and talk about it or address it, it continued to happen. It continued to happen. So at 5, I wound up in a hospital, 5 years old, and my vaginal tissues were severely torn by my stepfather. Um, and again, at that age, I have no clue what's going on. So all these things I was going through as a child, the men, my mother, and the whole dynamic of all that being born into that, this was just easy ground for those on the outside to continue to do what they were doing to me as a child, and that's violating me. So what happened as a result of all this, when you have someone who is avoiding what's going on and refusing to address what's going on, I was placed with other family. I was placed with my grandmother. Thank God. However, the abuse continued and I had no clue. I thought I was safe then. So, what I would like to share with all that sexual abuse, the domestic violence, and I grew up having my own relationships and going through sexual abuse and sexual assault, domestic violence, you name it. It was something that I look back on, it was like a reflection of my mother's life. I became an addict myself to deal with a lot of things that I was going through as a child. And all my life, what was easy for me was to run. It was what I knew. So I refused to address and talk about anything or tell anyone because of what was said to me. The grooming part of it, you don't tell anybody. That starts at home. I had to go to school. There were counselors I had to go to because I couldn't trust or tell anyone at home what was happening to me as a child. My mother knew, but she refused to do anything about it. So I went to counselors. I had to go to counselors, and I shouldn't, but I did. And believe it or not, I was actually advocating for myself because I'm like, I can't listen. I don't want to be in that home. I'm scared. So as I grew up, running from life and running from all the things I was going through, I wind up incarcerated in 1999. Went to Edna Mayhew Correctional Facility, and I spent 25 years and 9 months there. And I'm not blaming anyone. Like I said, I'm not making excuses for anyone. The fact of the matter was, I ran from a lot of things I was going through. And the more I ran, the more I wound up in trouble or in situations where I found myself like, how did I get here? It really was no fault of my own because I didn't know who to trust. So when you have a child who's grown, regardless of me being an adult, it was still here that, listen, I don't know who to trust. So I really wasn't helping myself, but I didn't know how. So when I got on the inside, I started counseling, but I made a decision to start learning everything I had been through. I started educating myself about everything I was going through. I might have missed some things, but I made a decision to start educating myself and finding out because there was no way I was going to leave Edna Mayhew Correctional Facility the same way I came in. There was no way I was going to do that. I refused to. But before I came home, I was advocating and mentoring on the inside And so many women on the inside who relate to me. I've actually sat down with so many women. They're my sisters on the inside. And we had no clue that we share similar stories, just different characters. That look, it never goes away because it's happening every day and it's been happening every day. That look, I see that look, I've seen that look since I've been home. This is what I'm saying. It's something that continues to go on because we collectively, we're not, I'm not saying we're not doing enough, we need to do more. Thank God that the men are stepping up and they're joining us now, women, because we're the ones who have been through so much, not saying that they have not, but they are stepping up and they are joining us now and helping us. This is an epidemic that has been going on for biblical times. You name it. This has been going on for a long time. But now that I'm home, before I left, like I said, before I left that place, I made sure that I was good mentally, emotionally, spiritually. And I came home and I decided before I came home the reentry part, I'm not gonna do reentry when I get out. Oh, I'm gonna do this when I get home. I'm gonna start it now. I'm going to start doing things now, putting things into play, putting not just for myself, but for others, so they don't have to go through these things that we have been through, those who have come home. These things I'm trying to do for women who are still on the inside, that they don't have to come home and go through these things. Okay, there's so many organizations out there that can help, but we have to be willing to reach out, be vulnerable enough and say, hey, I need this help because I'm tired of running from life. I want to get my life together and I want to like put a nail in the coffin. So my thing is I'm home now. Um, this is what I love doing. I'm passionate about this. And like I said, there's so many women, not just at the Mayhem Correctional Facility, but all over the world who are incarcerated. We don't just go to prison just because there are things that have stemmed in our lives that have shaped us and molded us to I don't know, it's the result of things. Is this, and like myself, let me speak on the I, because of all the things I was going through, and didn't know who to go to and who to trust. Um, I stayed inside, and it didn't help me. The silence didn't help me. So I encourage all you listeners, those who have been through what I went through, something similar to what I've been through. I encourage you. You don't have to be silent about anything that you're going through. You do not, and I encourage you to speak up and to someone that you know that you can trust. Go to someone and tell someone you talk to someone about that, because I know what that feels. I know what that is. I know how heavy it can be to carry that, and you need someone to just tell you like, listen, I need help with this. So again, I know what that feels like, and I just want to be here. I'm going to be here to all others go through what they're going through when it comes to mental health, domestic violence, sexual assault, sexual abuse, you name it, it's universal. So here I am. Thank you.
Thank you. Thank you, Don. That was very powerful. And thank you again for sharing your story, uh,
Yeah.
and for being here with us today. And I kind of did jumping into the questions, Don. I wanted to ask, is there something that you wish people understood a little bit differently about survivors, especially people who are coming from diverse backgrounds, from Black and Brown communities? Is there something that you want people who are listening now or who will listen later on to understand a little bit better about survivors like yourself and other women, girls, and people affected by sexual assault and this trauma to understand better?
What I have to say about that is what I was just speaking on. We can't remain silent. That does not help. It will not help. It will create more problems than anything. We have to let that out. And as far as the communities, whether it be Black and Brown communities, what they need to know is like, listen, keep your eyes open, okay? Get educated about this. This isn't going away no time soon. We've been talking about this for a very long time. Black and Brown communities, even the whites, but we're talking about the Black and Brown. You need to know what's going on in your homes. You need to get educated. You know, step up for your girls, your little girls, because we have a lot of them in here in this world. I have granddaughters. I'm home trying to protect now because I've seen it. I've seen that look. So the Black and Brown communities, you keep your eyes open, you stay educated, and you keep your eyes on your little girls and your little boys. Definitely.
Yeah. And
Yeah.
We do have a comment in the chat from Cookie that said,
Yes.
your strength and your choices to shine light on these horrors in my prayers always. So thank you, Cookie, for sharing.
Thank you, Cookie.
And
I said thank you.
always, Cookie, thank you.
Yes, thank you.
Being in talking about how we need to do better for our community,
Okay.
question for both of you, but how do we begin or how do we continue to do better and destigmatize the conversations that surround sexual violence within our communities and with our people?
I am so sorry. Do you know that you went out because this thing is in a way? I apologize. All right, let me get back to you. Okay, I have you back now. I so apologize. You were asking a question.
Yeah, no problem. Sorry about that.
Yes.
Um, I was saying how do we begin to do better in destigmatizing these conversations, like you mentioned, Don? And this can be answered by both Kelly and Don. I'd like both of your input.
Mhm. Okay. Here you go.
Okay, I can get us started. Thank you. Um, how do we begin to destigmatize the conversations? I think it really requires like intentional and culturally grounded efforts to honor survivors and challenge the silence, create safe and affirming spaces. We hear a lot about stigmas, and they're usually upheld by culture and fear and shame, religion and colonial history, right? And so it takes a lot out of each and every one of us to dismantle that. And so I really think that how we can destigmatize is just normalize the conversation, right? Use everyday language that talks about consent. Like I mentioned in the PowerPoint, what does consent mean? And teaching our little ones, what does consent mean? And not just the girls, but also the boys. What does it mean to give consent? What does it mean to receive consent? And talking about boundaries, right? So we want to make it language appropriate. So we talk about boundaries, healthy relationships, but not in moments of crisis. We want to bring this up conversationally each day. And then just challenging harmful myths and norms, right? Hearing like, oh, this only happens to women, or this happens to certain type of communities, and it's not true, right? We see the statistics, we've seen that it can happen to everyone and anyone, and just really being able to educate with around empowerment and not fear of, right, like not centering victim blaming, right, saying, well, why was she doing this, why were they doing that, kind of saying like, well, what can we do to prevent this, teach bodily autonomy, how can we frame the conversation around healing and liberation, and not focusing on the trauma, and just engaging men, like Dawn said, like have supporters of communities of men, elders, and community leaders. Those we see have major influence. And so the more we can be widespread and have other community supports, can break the toxic masculinity and the cycle of silence and the cycle of abuses. And pass it to
Absolutely.
Dawn. Yeah.
Okay. I'm back. So when it comes to answer your question about the stigma and the stigma, just has to hold on for a second. Apologies. Excuse me. Okay. So I want to piggyback off something Kelly said, and I don't want to come off in a way where, because I'm upset about it, because it's something, it continues to happen, and the innocence behind it. Innocence, you can't get that back. When we're talking about how do we stop this? Stop touching our children. Stop doing these things to our men and to our women. Stop doing these things to our children. Like I said. So like I said, since I've been home, and I I keep my eyes open. I'm not saying I'm going to live my life this way, but in order for these things to stop, like you said, Kelly, we have to keep this going. Let's keep talking about this. Let's keep this conversation going. Let's keep it going. It's normal because what's been going on for I don't know how long. Like I said, biblical times. So, in order for this to stop, in order for this epidemic to go away wholeheartedly, I believe we have to stop doing these things to our children. And again, I will not stop. Continue to get educated, be educated, the eye over our children, even when it comes to the courts. Even when it comes to the courts. I had that issue, if you do not mind me talking about that. So I explained that at 5, I was touched by my stepfather. So I was violated. So not only was I violated by this man, but I was also violated by the courts because they really didn't do anything. So this is what I'm saying. Addressing the issues that were going on with me as a child, I did not know how to do. That was for my mother to protect me and do. So we have to keep these conversations normal once again and open. These walls and groups and programs and discussions like this, we have to keep them open. We have to keep them going and talking about them because obviously this is not going anywhere anytime soon. And I'm so sorry about that. I really, really am sorry about that.
Oh yeah, so I'm hearing a lot of rethinking the ways that we that of the things that are normalized in society right now. We have to rethink the way we think about consent
Yes.
and and like who is a survivor or who can be a quote victim, and reframing all these previous ideologies around these topics and stuff. And I know, Don, you mentioned a barrier that you faced as a 5-year-old and in the criminal legal system, and I kind of wanted to dive a little bit more into that, because Kelly did mention that there are a lot of resources out there for survivors now, and be there are resources, but is it accessible for all? Is it not able to be navigated by all people? And so my next question is, what are some of the common barriers that survivors face when it comes to reporting sexual assault or sexual violence, um, or something of that nature? Don?
Oh yeah, I'm gonna take that one. Oh, Jesus. Um, they say that little girls don't talk about it enough. Is that what you're asking? The question you just asked?
It's the question is, what are common barriers that survivors?
Common.
Yeah.
So for me, the common thing was not being believed. And before not being believed, it was the shame I felt that was instilled in me. Um, this man groomed me in a way that he needed to groom me so that he could protect himself. So when it comes to that, that grooming part was not good for me, and the silence was not good for me. So um, shame, guilt, not being believed, you name it, it goes on. Um, it goes, I lived with that for years into my adulthood, because it continued to go on. Even though I got into my own relationships, still domestic violence and sexual abuse still went on. So it goes on, it continues to go on. So it's hard when you have no one to believe you and what you're saying and trying to tell them, like, listen, this is happening to me. So many women have come to me and say, well, my mother didn't believe me, or my mother beat me for saying something like that. This makes a child or a woman or a little girl not want to come forth and say, hey, this is happening to me, because this stuff is real. And to live with that and to carry that, that's a lot of weight for a child. And to grow up, it it trickles down and up into your adulthood, you know, because of what others have done to you, how they've molded you. So all that silence and shame and guilt that I dealt with, it didn't help me. It didn't help me. It did me more harm than anything. And so I want to put it out there. Little girls, whoever it may be, little boys, whoever it may be, you don't have to be ashamed. It's not your fault. That's their guilt. That's their shame. Everything that they're trying to make you feel, that's on them. That's not your way to carry. That's theirs.
Thank you. Thank you for that. And so I'm Kelly, would you like to add anything else around the barriers that survivors may face when reporting or when it comes to talking about these issues?
Sure. I mean, Dawn really just focused on a key aspect, right? So when someone's not believed, they're less likely to come forward. They may not feel like, well, if my own family won't believe me, what makes it that the court's going to believe me or this law enforcement? So that has a lot of when you're not feeling supported, it can really discourage a survivor stepping up because it's a lot to disclose alone. That's a lot. But there, I mean, other common, unfortunately, common barriers we see is distrust in law enforcement, distrust in the legal system. We see in media how that's portrayed when there's trials and how often survivors are not believed even after hours of testimony. Um, there may also be a lot of cultural stigma, right, within family. Like we hear, oh, well, we don't talk about that. Or this will bring shame to our family, or a lot of other maybe cultural references that we have all have heard or witnessed in our own families. But the racial stereotyping is really harmful, right? Because it can
Yes.
lead to the dismissal of
Mhm.
victims, survivors, claims, and then creates that environment that normalizes the abuse. And that is a big barrier, right? It's like if the perpetrator is the sole provider for the house, then we can't pursue any action. We can't remove that person from our household because we're financially dependent on them. So there's other factors to consider, and those are reasons maybe someone um, may not want to report or may have internalized struggles with whether or not to come forward.
Right. So it's not just the systems that may not be working for survivors, but it's also we have to look at our cultures, our the way our communities are built, the way people aren't believed when they share their stories and stuff, and rethinking that. And so kind of to piggy off of that, how do we as communities go about creating these safe spaces or these places that are equipped to support survivors and to help them on their healing journeys or help them in whichever ways they need help in.
The best thing to do for that, keep what we're doing right now, is keep this open. Always allow survivors and those who have been violated, always let them know that they have a place that they can come to. They always have that. So it's saying, writing that, place right for others who do not have that, so they don't have to go through that to be subjected. However, if they do have to go through something like that, that must be God ordained. Okay. Just like everything I've gone through in my own life, um, which is why I'm able to speak about this today without the crying, without the shame, without the guilt. I got all that back. I took all that back. They didn't give it back to me. I took all that back because I educated and I wanted to know what was it with me. It wasn't my fault. So now I'm here to help, continue to help. So keep walls, keep doors like this open for we don't know who. We
Mm.
don't know. There's a lot of us. There's a lot of us. So keep this conversation going.
I definitely second that.
Yeah,
Yeah,
yeah.
it's a lot of building trust and safety, but that trust isn't going to be built overnight for folks. I always say that if someone is disclosing to you, it's such a privilege and an honor because they trust you, and they have so much. Uh, and they want to share that with you, right? They're trusting you with that disclosure. And so building that trust and safety, just start by listening, right? The goal is to not get a disclosure. the goal is to listen and say, like, I believe you and I hear you, right? We don't need the details. We don't need to ask why questions, but just being responsive and listening. Um, that can open so many that just gives that encouragement for that person to just continue to feel believed, and maybe anyone else who told them that that sounds crazy or whatever, that they have someone else to lean on, right? And so you want to, upon getting a disclosure, is just honor their autonomy and choice, um, deciding whether or not they want to pursue legally or if they want to even get services locally. Um, that's their decision how they want to do it, and to prioritize what they want and encourage their autonomy to decide what they would like to do, and just thinking culturally lens, right? Finding resource offering, first of all, that's the big one, is offering to help look for resources. It can be overwhelming. So to say, oh, you need to go see this place, you need to go here, rather saying, well, can I help you? Maybe we can put together a list of resources for when you're ready. Right. And then finding um, culturally specific resources, or maybe some other places that might be more well suited for the survivor, but not pushing them to take on these resources, right? And not to make it like get upset because they're not taking the resources, but saying like it's here for when you're ready. I think it's just how being able to really put the survivors in the center and offering support without pushing for them to take the support.
Thank you, Kelly and Don. And then my final question, before we open it up to people in the audience who may have other questions or comments. We're here in recognition of Minority Mental Health Month, right? So it wouldn't be right of me to not try and connect this to mental health. And so, how does these experience with sexual assault, sexual violence, how does that affect a person's mental health? And then the second part of that question is how that we can build um, these responses or these practices to help people through their journey and through their healing process. Oh, oh my eyes twitching.
I could start off with the first section. So how does that intersect with mental health? Um, I mean, any trauma, sexual assault, domestic violence, any form of trauma, right, can have lasting impacts on someone's mental health. And it's often magnified for survivors, and especially from marginalized backgrounds, because there's that added layer of trauma of systemic inequities, lack of culturally competent care. So all those are compounded, and unfortunately, we see a lot of buildup. It could be PTSD, uh, depression, anxiety, substance misuse, self harm. I mean, the list goes on, right? I can't even begin to say all of it. And we see that I mean, there's just racial trauma and structural oppression, right? We might see that a Black and brown survivor may not only be just coping with the trauma of sexual assault, but they may also be with the stress of being disbelieved because of racial stereotypes, or because of distrust and harmful actions by law enforcement. So those are compounding factors. I think a lot about Kimberly Crenshaw, I believe that's the person's name, and they talk a lot about intersectionality, and how they talk. It shows that Black, brown, immigrant communities, women especially, face like compounded forms of marginalizations, whether it be race, gender, class, immigration status, and it really shapes their experience with violence and how they have access to justice, right? And the lack of care and resources available to them because of where they're living, or because of their access to it, can impact their mental health significantly. and I forget the second section. So,
Mm.
That's okay. I was gonna let Dawn speak, because you're unmuted, and then I can repeat the second portion.
Okay. Uh, well, for me, when it comes to answering that question, if you don't mind, by example, when mental health comes into play after trauma, it led me to a very very dark place. I cried a lot. I had nightmares. Because of all the things that were going on with me. School. They're calling my grandmother. Your granddaughter needs help. I wind up in special education classes as a little girl. And it wasn't that I was slow, or I don't like that word. It wasn't that I didn't understand or whatever. It was that my life had been impacted in a very, very negative way. And no one could understand what I was feeling. Even I didn't know what I was feeling. As a child, I just knew that all I did was cry because of I'm afraid to go home because I know that when I get home, this is going to happen to me again. That's very, very, I talk about the weight. That was very, very heavy for me to carry as a child. It's something I should never have to go through. But it did. But it did. But it did. Um, but it led me to, like I said, a very, very dark place, the mental health. And so now today I have PTSD, I have anxiety, I have depression, all these things. I don't want them, but they are part of me. They are part of my past. They are part of life and what I've been through as a little girl, as a child, doesn't matter. These are the things that have in my life. And as a result of that, now I have these things I'm dealing with in life. Don't get me wrong, I'm going to continue to address them as well because it's something I didn't always know how to do. But because I do know this is what I have, I need to address these things. But mental health, got to keep that sharp. You got to keep that healthy, just like we got to keep our bodies healthy, especially when it comes to trauma.
Body and mind and soul healthy.
Yes. Yeah.
Very important. And I think what I'm getting from the overall conversation that we've been having so far is that if this thing doesn't just impact one person. Sexual assault, sexual violence does not impact one person. It impacts us as a whole, as a community, as a society. When one person, or well, it's not just one person. There are many survivors, and when they're not functioning, or they've been impacted by this violence and they have this trauma, it's very um there are those effects not just on one person's mental health, but like a family, an entire ecosystem, an entire community's well-being and overall healthiness. And so I think that's a very important point to like bring up and to make. And so um I know it's a little bit past 1 p.m., but I do want to give time for people in the audience who are still with us. If you have any questions, if you have any comments that you would like to ask for our speakers today, I did see a comment from Maria Rojas who says, "Thank you for sharing your story, Dawn. It was very brave of you to do what you are doing, and it takes a lot of courage to do the work that was not done for you." But right now we're opening up to any other comments or questions before we wrap up today's conversation. Mm. Okay, so I guess I'll bring it back to Kelly and Don. Do you have any last comments or any last statements that you want to leave with the audience before we close out for today?
um, just again, thank you all for listening to us, engaging in these important conversations. It really starts with preventative efforts such as these, to listen and learn and just share the information out. Um, Again, there are resources in every county. It is not, um, again, a survivor does not have to take on these resources, but just know that it is available. And the goal is to support them however they need the support. And just really an immense thank you to you all, to Dawn for being here. to the Latino Action Network Foundation, you all. It's really our interpreters. It's communities and supports like this that we need, right? I could probably go on forever talking about this, and unfortunately, like Dawn said, this will not probably go away anytime soon. Although I would like that because then I'd be out of a job. But if not, we're here doing the preventative efforts and just spreading awareness.
Okay, so I'm gonna do my best not to get emotional with this one. First and foremost, Dr. Jesselie De La Cruz, thank you so much. God bless you. I met her on the inside. And not too long ago, she was telling me, because she heard my story, and she said, things that we go through in life, and I totally agree, the things that we go through in life, more than just ourselves, others. She used to always ask, why me? Why me? Why me? I'm a very spiritual person. There are people who aren't. But when it comes to God, I didn't understand. I was mad at God for Him allowing me to go through all I was going through. He allowed me to go through this very reason today. I'm grateful. This is an honor. I don't love the rooms like I don't love rooms like in the way that it may sound, but I love the fact that this narrative, we're continuing to keep this line of communication and awareness open. Open, let it stay open for as long as it takes. I hate that it continues to go on today, but all right. So here we are. Thank you, Latin Action Network. Thank you, everyone, for coming today, and thank you for allowing me to share my story with those who can relate or whatever. Let's keep an eye on our children, and let's stay collective together so we can fight this thing because, like I said, it ain't going nowhere no time. So, but thank you for having me. Yeah, this was an honor.
Thank you, Don. It was an honor to meet you as well and to have you here with us today, Kelly as well. Thank you both for working with me and putting this webinar and this conversation together. Thank you to the interpreters as well, because this conversation is very important to have in other languages, in Spanish, and to include our communities in the conversations and to make this information accessible as well. And thank you all for staying with us. And listening in on today's conversation and joining us. And I will be following up with the recording for this presentation for you all to share with maybe a coworker, a friend, someone that you think needs to hear this information, needs to hear what we are talking about today. And then I'll be sure to follow up also with the resources that NJ Casa shared and contact information as well. So again, thank you everybody for joining us, and we'll be here for the next one. We'll see you guys soon. Yep. Awesome. Bye everybody. I'm going to